Yeah, hi everyone. Welcome to my YouTube channel. Today we're gonna treat this topic called painful intercourse. I had a patient a while ago who actually complained of this issue, so I've decided to make this video or video clip to explain further what it is, how it can be managed, and yeah, that's it. So she complained of painful intercourse. That's during sexual activity, she experienced pain. So and got to me. So I said, hey, let me make a video for a wider explanation to everyone. The medical term for painful intercourse is dyspareunia. What is dyspareunia? Dyspareunia is defined as a pelvic pain with sexual activity. It is common and can manifest in many ways, including pain or discomfort during penetrative intercourse and digital activity. Dyspareunia can affect up to 10 to 20% of women and trans people of all ages. Now, this condition is characterized in three different classes, as we say, superficial versus deep, that's one class. Primary versus secondary, that's another class. Generalized versus situational, that's the third class. So I will now describe each of these classes for you to understand what it is. So for the superficial versus deep, when pain exists with initial penetration, that is superficial, versus pain occurring with deep vaginal penetration. Both types of pain can occur at the same time. Then we have the other class now called primary versus secondary. If pain has existed since a first sexual experience debut, it is called primary dyspareunia. Secondary dyspareunia is when it's been after a period when sexual activity was not painful. And the last one, generalized versus situational, when pain with intercourse occurs in different situations, generalized, or with one sexual partner or one type of encounter, situational. Now, let's look at the significance of dyspareunia. Dyspareunia can cause significant stress and or social isolation. Individuals who suffer from chronic genital pain may find it difficult to seek treatment or support. Many people with dyspareunia may have decreased sexual frequency, interest, or arousal, which may cause relationship distress. Studies have found a relationship between dyspareunia and depression and anxiety. Now let's look at the causes. So causes could be biological, psychological, relational, social, cultural. So biological, we have gynecologic condition, e.g. vaginitis, endometriosis, infection, that is yeast, pelvic inflammation disease, PID, or dermatologic condition, e.g. lichen sclerosis. Menopausal, vaginal atrophy from genitourinary syndrome of menopause. Medications used, for example, SSRIs, that's selective serotonin reuptake inhibitor. It's a popular drug that we use here in the Western world. And then we have a nice psychotics chemotherapeutic agent. Now, for psychological, we have psychological conditions such as anxiety or depression can contribute to dyspareunia. Past history of abuse. Then, for relational, we have inadequate stimulation, inadequate lubrication, and relationship quality. For social cultural, we have personal values, religious influences, and cultural expectation. Usually, the causes of dyspareunia are multifactorial. This means that dyspareunia is caused by many things which work together to cause the sensation of pain. Now, let's look at assessment of dyspareunia. If you believe you have dyspareunia, you should contact your family physician or gynecologist for a comprehensive health assessment. Usually, a care provider will begin to ask you a series of questions. These can include collecting information about past birth, trauma, pelvic floor surgery, bowel function, bladder function, psychological history, pain characteristics, sexual history, history of abuse. They may perform a physical exam, including a pelvic exam. However, this is not always necessary. Physical exams help to rule out conditions that may be contributing to dyspareunia. Your doctor should be aware of your pain and aim to make the assessment as comfortable as possible. Always communicate if you are experiencing any discomfort so your physician can adjust or stop the physical exams immediately. Now, let's look at how to treat this condition. Management depends on the cause. Since the cause of dyspareunia is usually multifactorial, a comprehensive multifaceted management plan may be required to address the contributing aspect. We have now management options which include pelvic floor physiotherapy. Often, the goal is to strengthen and relax the pelvic floor muscles to allow for entry into the vaginal canal as well as restrain pain receptors. This is done over many weeks. The next one is psychotherapy. This may address history of abuse or psychological conditions that are contributing to dyspareunia. Cognitive behavior therapy can be done to focus on the thinking pattern associated with pain and fear, the emotions associated with these thoughts, and the subsequent behaviors these thoughts and emotion may cause. Lubricants. Products such as coconut oil can lubricate the vaginal canal, decreasing function upon vaginal entry. Moisturizer. Moisturizers differ from lubricant because they bind to water molecules, creating a film-like barrier that may potentially last longer than a lubricant. Anesthetics. For women with pain upon entry, Application of topical lidocaine around the vagina introitus, that's the entry, can help numb the area to allow for penetration or stimulation. It is important that a cis-male sexual partner wear a condom to prevent desensitization of their genital. Hormonal therapy. For women with vaginal dryness caused by low estrogens may help with symptoms of dryness and irritation. So we're talking about medical therapy at this stage. Other medications such as steroids and antibiotics and antifungal depend on the cause of dyspareunia. Others, options such as surgery or Botox injection are unusual and not typically recommended, but may be an option depending on the primary cause. So we have this Botox that we usually inject 1 milliliter around the vagina area that goes to take away this discomfort, or what we call shrinking. So that's another option. Now, summary. Dyspareunia is characterized by pelvic pain during sexual activity, affecting up to 20% of women and trans individuals across all age group, manifesting as discomfort during penetrative intercourse or digital stimulation. The condition can be characterized into various types, including superficial versus deep pain, primary, that is existing from the first sexual experience, versus secondary, that is developing after previously pain-free experiences, and generalized, that is occurring in different situations, versus situational, that is specific to certain partners or encounters. Dyspareunia can lead to significant emotional stress, social isolation, decreased sexual interest, and relationships issues, with contributing factors ranging from biological, that is infections, hormonal changes, to psychological and social cultural influences. If experiencing dyspareunia, individuals should consult a healthcare provider for a thorough assessment, which may include physical exams, psychological evaluation. Treatment options vary and can include pelvic floor physiotherapy, psychotherapy, lubricants, medical therapy, and more, tailored to address the multifactorial nature of the pain. Dyspareunia is characterized by pelvic pain during sexual activity, often manifesting as a discomfort during penetrative intercourse or digital stimulation. The condition can affect up to 20% of women and trans individuals across all age groups. Dyspareunia is characterized into various types such as superficial or deep pain, primary or secondary onset, and generalized or situational experiences. By recognizing these categories, individuals can better navigate the complex series of dyspareunia and its impact on their sexual health and relationship. What is dyspareunia? Which I've already answered that one. The category, that one also we saw it. So now let's look at the impact of dyspareunia. Dyspareunia can lead to considerable stress and social isolation, making it challenging for individuals with chronic genital pain to seek treatment or support. Many experience decreased sexual frequency, interest, or arousal, potentially causing relationship distress. Additionally, studies have identified a link between dyspareunia and increased rate of depression and anxiety. Now, causes of dyspareunia. Dyspareunia is typically multifactorial, like I said before, meaning it is the result of a combination of factors that contribute to the experience of pain. Biological. Biological causes of dyspareunia can include gynecological conditions such as vaginitis and endometriosis. Infection, which could be yeast or pelvic inflammatory disease. Dermatologic condition, which could be lichen sclerosis. Menopause, which could be vaginal atrophy from genitourinary syndrome of menopause. Medication use, which could be selective serotonin reuptake inhibitor SSRIs, and antipsychotics, chemotherapeutic agent. For the psychological aspect, we have anxiety, depression, and other psychological disorder can contribute to dyspareunia along with a past history of abuse. Relational issues may contribute to dyspareunia due to the emotional and psychological stress they create. Potential causes of dyspareunia can also consist of inadequate stimulation and lubrication, and the overall quality of your relationship. Social-cultural issues can contribute to dyspareunia by shaping beliefs, attitude, and expectations around sexuality. Personal values, religious influences, and cultural expectations can also lead to dyspareunia. Assessment of dyspareunia. If you believe you have dyspareunia, you should contact your family physician or gynecologist for a comprehensive health assessment. Usually, a care provider will begin the assessment by asking you a series of questions. These can include past birth, trauma, and pelvic floor surgery, bowel function, bladder function, psychological history, history of abuse, pain characteristics, sexual history. Diagnosing dyspareunia. Your doctor may perform a physical assessment including a pelvic exam. However, this is not always necessary. Physical exams help to rule out conditions that may be contributing to dyspareunia. It is important that your doctor is made aware of your pain and should aim to make the assessment as comfortable as possible. Always communicate if you are experiencing any discomfort so that the healthcare professional can adjust or stop the physical exams immediately. For treatment options and management of dyspareunia vary based on the cause, and since dyspareunia is often multifactorial, a comprehensive and multifaceted approach may be necessary. Treatment options include pelvic floor physiotherapy. Often the goal is to strengthen and relax the pelvic floor muscles to allow for entry into the vaginal canal, as well as retrained pain receptors. This is done over many weeks. Psychotherapy. This may address a history of abuse or psychological conditions that are contributing to dyspareunia. Cognitive behavioral therapy can be done to focus on the thinking pattern associated with pain and fear, the emotions associated with these thoughts and the subsequent behaviors these thoughts and emotions may cause. Lubricants, products such as coconut oil, can lubricate the vaginal canal, decreasing friction upon vagina entry. Moisturizers differ from lubricants because they bind to water molecules, creating a film-like barrier that may potentially last longer than a lubricant. Anesthetics. For pain upon entering, the application of topical lidocaine around the vagina entrance can help numb the area to allow for penetration or stimulation. It's important that a cis male sexual partner wears a condom to prevent desensitization of their genital organs. Medical therapy for women with vaginal dryness caused by low estrogen. Local estrogen may help with symptoms of dryness and irritation. Other medications such as steroids, antibiotics, and antifungal depend on the cause of dyspareunia. Options such as surgery or Botox injection are unusual and not typically recommended, but may be an option depending on the primary cause. Staying informed about your well-being. Dyspareunia or pelvic pain during sexual activity is a common condition that can significantly affect individuals' sexual health and relationships. Addressing the multifactorial nature of dyspareunia through a comprehensive management plan can lead to improved well-being and a more satisfying sexual experience for those affected. If you are experiencing pain and discomfort, speak to your doctor about your treatment options and start your path towards feeling your absolute best. I think we've come to an end of this lecture. And once more, thank you for listening to my YouTube channel. My name is Dr. WAN. Please subscribe, ask your question, and I'll be more than happy to help you. Thank you, and have a wonderful evening. Ciao.